I don't block the guy where they ask for money. I don't block him. These people where they ask for money, one girl sent me message. Listen to this message, guys, before we go to Mobad. She said, the lady you blocked on WhatsApp, I asked for assistance from you. I told you I have a mixed race daughter and a retired flight attendant. I'm penniless again and no food. Please assist me, Daddy Freeze. I sent her a line. I said, you want me to block you here again? You frustrated my life on WhatsApp. I block you. I'm not afraid of block. It's because of situation. Never mind. I won't bother you again. Thanks. I said, please don't. You bothered me so much I had to block you and you are here bothering me again. What makes you feel that I owe you money? But where do I know you from? The level of entitlement in Nigeria. Can you guys hear me? As in, you see, I was talking to a friend of mine today, Chef Lolo's. He said one lady walked up to him once and said she wants to work with him. He said he's not hiring, that he doesn't have space. She said she'll work for him free for 6 months. If after that he likes what she's doing, he should pay her. The guy look and say, why will you work for free? I can't let you work for free. The girl said, no. I will work for free. You don't get people like that in Nigeria. You don't get people that walk up to you and try to solve a problem or proffer a solution. Instead, they don't know you from anywhere. They walk up to you and they start begging. From nowhere. Like you worked and I'm owing you salary. Where do I know you from? How do I trust that you are not a scammer? I was just scammed 2 days ago. So anyway, let's go to Mobad. That is what brought us here. Kpai Mobad. I was reading the coroner's report, and the coroner's report said it was nurse's negligence. I'm sorry, personally, I feel there's more to this Mobad. I don't know who to hold. I don't know what to hold. I don't know what to say. I don't know what to say, but there is a lot that we are not hearing. Coroner rules out foul play in Mobad's demise, recommends nurses prosecution for negligence. The coroner's court investigating the Kpai of singer Mobad, popularly known as Ilerioluwa, popularly known as Mobad, has ruled out foul play in the case, delivering her findings on Friday at the Ikorodu Magistrate Court in Lagos. Magistrate Adedayo Shotobi concluded that the singer's demise was not as a result of any criminal act. However, the coroner found that the actions of the auxiliary nurse, Feishayo Ogedengbe, who administered an injection on Mobad without a doctor's prescription, were both unlawful and professionally negligent. The court recommended that the nurse be prosecuted for gross negligence and illegal medical practice. Citing Section 29 of the Lagos State Coroner's Law, the magistrate urged the Directorate of Public Prosecution to take up the case against the unlicensed nurse. The coroner also called for further investigation into a prior petition by Mobad against Naira Marley and Sam Larry, alleging ASSAULT and intimidation issues that resurfaced during the inquest. I don't see how that is tied to nurse malpractice. I'm sorry, but that bothers me. the intimidation. She na we give wrong medication, na im dey intimidate, or na the Mobad where they intimidate, na im make the nurse give am. I don't understand why they are tied together, but anyway, the law knows better. The court criticized Mobad's father for burying him hastily without insisting on an autopsy, and faulted the singer's wife for not taking him to the hospital promptly when he fell ill. The court further noted that social media influencers and content creators had distorted facts about the case during the proceedings in ways that could compromise the integrity of the judicial process. Lastly, the coroner recommended broad reforms, including improvement in healthcare service delivery and stronger responses from law enforcement to protect citizens. Wow. So, before I say more, I'd like to invite you and ask you, what are your thoughts? What do you think? Do you think? It's an open conversation. Personally, I've said it before, I don't believe Naira Marley or Sam Larry had any hand in his demise. They might have had some misunderstandings, and Naira Marley and Sam Larry could have gone overboard in, they are street boys, so they were using street agidi. But anything that went beyond that intimidation, saying I didn't buy him, I don't believe. I've always said it from the beginning. If you followed me from the beginning of this case, I talk and say, I no believe saying Naira Marley, and I no believe saying Sam Larry. Yes, what they did was not good, and if they should be prosecuted for it, we're all fine. Let them be prosecuted. However, personally, that saying I didn't buy him, I no believe. Maybe I'm wrong, but I think I'm entitled to my beliefs. So, nurse negligence is what I have also believed from the beginning. You understand? That auxiliary nurse. Now, you see, we also have to hold Wumi account. Initially, I said, I know, I be like say this Corona self can't make sense, sha. Wumi, why would you call a nurse instead of taking him to the hospital? But then, maybe Mobad did not want to go to the hospital for whatever reason. It's a very I don't want judge the matter, because right now what the coroner said is na the nurse. I don't know. Make I open up my lines, make I hear what people got to say. It's sad, but finally maybe the guy will be able to will be laid to rest. Abi, at least now he go feel sleep. Brother, how you doing?
Fine, oh, daddy face.
You have to be careful with your words, oh. No say you have to say bye, or don't say anything way strong. All right, go ahead. What are your thoughts about the coroner's inquest?
Personally, right from time, I already know there's no foul play. Like, I already know it's the nurse. Like,
How do you know? How did you know?
Listening to story from here and there, listening to what the dad said, what Mumi said, from the beginning of the case, I already know the issue is from the nurse. I have friends that will always go to chemists and just go take drink. That, oh, are they sick, And I will always use mobile issue as example to them. Even my own mama too, Sabi patronize all those nurses. So I they always use this mobile issue as example for them. Say, man, nurse is not a doctor. You understand? So I think I've always known this because I was an architect, right? And then people will always, feel bricklayers can do our job. You get what I'm saying? Like you try to let them understand that a bricklayer can never be a builder, they can never be an architect because laying of block and understanding structures are two different things, right? So I already know the only foul play that so officer very dark man starts on, investigation, listening to what everybody is saying. You can still say it's the nurse, but then very dark man is trying to say there's a foul play. The only foul play you want talk now say maybe the wife carries something, hit her for head and
hold on. Don't you can't go against him. Let's you see see I want us to stick to what the coroner said. Let us he's doing a great job trying to make his own findings, which I believe no other independent journalist or anybody else did any. He's the only one that did investigative journalism on this particular case. So you've got to give him that his credit, and let's just work. To me, I'm not. But don't bring him into the conversation. Don't. How do I put it? You could create a narrative that is incorrect. So let's stick with the coroner. This is what the coroner said. For me, it's just funny. Everything, not just. But I don't know waiting to talk.
The report is accurate. If you ask me, I think the report is accurate.
Okay, so you are of the belief that the report is accurate.
I believe the report is accurate.
Do you believe his wife had anything to do with his demise?
No.
All right, we've got some people in the house. Brother, stay. Yeah, we've got some people in the house. Please show your faces. All right, go ahead, my sister. What are your thoughts?
Okay. I don't know if you remember me. Your life a couple of times. Okay. And I remember when that happened. I think I was one of the first few people that was in your life talking about it. I'm a registered nurse.
Okay. All right, we're back. Network was bad. Sorry, guys. Slow connection. Network is bad. Now I say, why did I block your friend? I block anybody that brings problem to my life. It's as simple as that. You bring problem, you bring quarrel, you bring disagreement, anything that is not okay, I will have you blocked. All right, we're getting back. We're getting more people. Thank you. So everybody's back. So I would love to invite the lady that was talking earlier on. The lady that was talking earlier on, please join us back. Please do not join me if you don't have a decent backdrop. Don't say, now money be my problem. I hope you won't block me too. I will block you if money is your problem, as long as you don't ask me for it. Sorry, IPNX has very horrible network and I'm on them. I've been complaining about it. Who is this one? Talk now. We're back, we're back, we're back. Thank you, Rafiat. God bless you. Kamaruddin, we're back. Welcome back. I had a lady who was talking with me earlier on. Send me a request. So what exactly is... Okay, I think I'm... My sister, welcome back.
Yeah, so like I was saying.
All right, go ahead. All right, she was talking before we went on the break. All right, my sister, let me hear you.
Okay. Oh, me? So, yeah. So what's evident that what's fighting was the drug interact, the med, like I said, we had goosebumps. That is clearly an interaction. And I'm sure he had other stuff. That's whatever medication that they gave him interacted with. If you go to a medical doctor, if you're going to get a medication, they will ask you, what other medications are you taking? Over-the-counter medication, multivitamins, even herbs, even teas. Because some of them can interact with...
Even grapefruit. Grapefruit.
Grapefruit will minimize the absorption of medication. Like if you're taking a medication and you're taking grapefruit, it will not work well. Grapefruit, yes, you are very correct. So like I said, I'm sure what happened. But the question was, why did they have to call the nurse? What led to calling of the nurse and all of that? I think that's where people are kind of pointing to the wife that maybe she did something or whatever. But I'm not surprised at at the court ruling or whatever. I'm not surprised at all because it was clear. It was clear from the onset. That's my that's my own.
Quite a lot of people. Somebody said. DF, can you read what Scanty Black Official said? Scanty Black Official. Scanty Black Official. Now let's be careful not to spread rumors. Who is Scanty Black Official? Who is Scanty Black Official? They said I should hear what she... All right, my other sister is here. Welcome, guys. How are you all doing? Is network this bad? My sister, if you're driving, press mute.
I'm able to see you, to see the other lady on the screen. Can you see me?
Yes, I can see you. Go ahead. Go ahead. Just talk. We can see you.
Okay.
Go ahead. This is not my network. This is her network.
Okay, let me get up.
Not you. You are fine. You are fine. It is her network that is bad. It is her network that is bad.
It's okay.
So go ahead.
Can you hear me?
Yes, I can hear you.
Okay, so
Her network is very bad.
and everybody.
Your network is very bad. Your network is very bad. And if I remove her, she will lock that space. So I won't be able to bring anybody else. Please, guys, if your network is not good, don't bother. If your network is not good, don't bother.
Hello.
Yes.
Good evening. I don't know if you can see me, but I just have something to say and I'm going to get up.
Put on your lights. I can't see you without lights. How you do? Let's wait for the lady to talk first.
Can you see me?
I can see you, but I can't see the lady.
Can I just say what I want to say and get up?
Remove yourself and bring yourself back. Then you can. I don't like people talking on sensitive matters while they're hiding their faces.
So can you see me now?
I can see you, brother. You go ahead.
Okay, I think we are locked up on based on emotions, the country we are into, and sentiment factors and all this kind of stuff, right? I think within the quest of trying to know what actually by the young man, some doubt of, can you just do this for us? Can you add to what we can use to try to fish out this, how we are trying, how we are going to come together to, see it, okay, since you said they took him from you, what do you have to add to make us, add to help you, for the family to get justice, for you to get justice? I think that's what around the first process of trying to point in or trying to doubt both the inquest, the coroner inquest and all that, and understanding the judicial system, the process of this, that, and it's all delayed to all this, and the more people get curious as well. That is how it is. Understanding the Nigerian, the system we are in too. So we can also bring in that, but since the inquest has said this is it, we can still say okay, but
do you trust the inquest?
I can't. That's the inquest, right? Which we might not argue or we won't doubt. So we will stop there. But we as citizens, we as average human beings, if you allow us to put our heads and reason, some people might still go beyond extent. That's the truth. I can say, okay, but why didn't you do this? You could have added from the family, from the dad to from the wife and the whole emotional stuff. Then that's it. But our society, we need to understand the judicial system too. It's also delayed to the trust we might. Minutes. And the curiosity and all that.
All right. Thank you for that. We have another gentleman here. Brother, talk to us.
Yes, Daddy Freeze, good evening.
Good evening, brother. How are you doing?
I'm fine. I've been one of your added followers.
My brother, nice to meet you.
Nice to meet you too. So, I mean, in the medical world, what happened to Mobad was quite explanatory from the get-go. The thing is that you would have lots of medical people not very keen to come to air their opinion, and the reason is that, I mean, Nigerians are quite emotional, and in cases like this, they're usually fast to insult people. So, what is the history here? And the history is quite self-explanatory, and it also highlights the issue of quackery and negligence in our medical system. Of course, the structure, the medical legal structure is still quite nascent and very underdeveloped. Mobad went out, was involved in a fight. He sustained an injury with a swelling on his knuckle. Is that a natural phenomenon, or is there any scientific explanation to that? Absolutely correct. What he had was inflammation, which would happen between the first 24 to 72 hours. And this is what acute inflammation is all about. And of course, I don't want to go down towards explaining that entails, but I could give a snippet into it.
Please go ahead.
Your body has a blood, and the blood is called white blood cell. Now, when you have any form of injury, there is what is called chemotaxis. And this is the white blood cell moves towards the area of that inflammation. When it moves towards the area of that inflammation, your body will secrete other chemicals, and they are called cytokines. The cytokines and the white cell, and the interplay between them and other transmitters go on to cause what is called acute inflammation. And the way your body responds, it's what swelling, redness, which we call as a rubor, and also hotness. So these are what makes up acute inflammation. Now, Mubad had this thing. It's not going to happen immediately, but happens a day or two later, which was what he had. Now, Mubad went on. There is this thing about Nigerians where, because we have a little amount of money, we think that we can easily call we will have our own personal doctors or nurses. And I keep saying this, however little your illness may be, the pathway to seeking healthcare is to see a doctor, have a doctor assess you, take a history, do an examination, request investigations if required, and then offer maybe what we call empirical treatment, and with the results eventually offer you the main treatment that you need. Mobad, in this case, feels that, I don't need to go to the hospital. I can call someone to come in to treat me. He had his own nurse, which ideally such things should not be happening. If King Charles falls sick today, no matter how little that sickness is, King Charles goes to the hospital. He does not have any personal physician that comes to the house to see him.
Is that so?
Now, yes, he has a personal physician that could check him at home. But when he falls sick and there is any concerns, King Charles still uses the hospital. He uses the NHS. Now, when Mobad called this nurse was unavailable at the time, and then asked for another person whom I cannot verify her qualifications to go to the house. Now, I'm sure you're aware of this epidemic in Nigeria where anyone is sick, and there's this idiosyncrasy that injections are better than tablets.
Absolutely.
Which is not the case. There is tablets. The tablets works as much as the injection, but there are reasons why you can have the tablet and the reasons why you can have the injection. In this case, this nurse came. What history did he take? The nurse take. One of the most common medications that people are allergic to is antibiotics. That is one of the major, and the most antibiotics that people are allergic to are the beta-lactams. The beta-lactams could be the penicillins, it could be the cephalosporins. And for anyone that had injury, most people sometimes go on to start giving tetanus toxoid injection. Why would you give tetanus toxoid injection to everyone? There are people
who are reactive to it. Yes.
And there are people who shouldn't have it.
And normally, I remember growing up, before you give someone tetanus toxoid, you give them a little bit under the skin to see if they are reactive.
There's a text that used to be in the past.
Yes.
And for tetanus toxoid, you also, if you go read about the therapeutic index, the information is there. Read about it, and then it tells you that, okay, if this person has any form of allergies. Now, look at the entity like Nigeria.
Because tetanus toxoid is gotten from cow heart or horse heart that they are allowed to rot, so that it can breed the Bacillium tetani, or what's the name of that bacillus?
Yes, the Clostridium tetani.
Clostridium tetani, thank you. Continue, my brother.
So in this case, had injection and another medication or injection. First of all, what stops her or the nurse from taking a history? Have you had this medication before? Have you had any form of allergies before? Sometimes we do take medications and we end up having a little rash on our body and we ignore it because it's nothing. And then what happens if you've had any major any allergy before, however mild it is, if you are exposed to that substance again, you're likely to have anaphylaxis. Now, anaphylaxis is a severe form of an allergy where you could where a lot of what we call histamines are released by some sensitive cells in your body, and what it does is that it causes it blocks the airway that you're unable to breathe, and then it causes a lot of reaction because these chemicals move towards there. You're unable to breathe, and then you could have waves or rashes all over your body, and most people would shut down if you do not
Completely.
have adrenaline
Steroids,
in your pulse.
adrenaline, for instance, to give straight to the
Adrenaline is the
heart.
major thing. So if you're going to give any form of medical treatment to anyone at home, you should have a prepared with you. That is a basic. You've not taken any history from this patient whatsoever. You're not aware what he is taking. A Yoruba boy who grew up in the street, in the street, who probably has not been exposed to any of this medication. You went ahead to give him this medication. Immediately, what happened? What was the reaction? The reaction was that the guy started, before you knew it, he couldn't breathe, right? And that was what we call laryngeal edema. The larynx is in the airway, and because
The
of the having
larynx is your voice
inflammation,
box, is what you use to talk.
exactly,
That's
it
the
swells
larynx.
up, and then because it swells up, air in trachea into the bronchial into the lung, so the lung is collapsing. You're not getting enough air, and when you're not getting enough air, you're not getting oxygen into your body. Now, the heart is made up of what we call the pulmonary vessels. They take blood that are
From the
not
lungs.
oxygenated, the one that has no oxygen to the they take it to the lungs, and then it picks it back up into the heart, and then from the left side of the heart into the major vessel, the aorta, which now takes oxygenated body to the rest of your body. In this case, Mobad has not had any oxygen in his body for 4 to 5 minutes, and the brain cannot use any other form of fuel. And if the brain lacks
Hypoxia.
oxygen for 4 to 5 minutes, it becomes hypoxic, lactic acidosis, and seizure will ensue. So he was having seizures.
Hey.
Because he was having seizures and there was no adrenaline in place to be able to reverse this reaction on other medications like antihistamines and steroids, like you said, he cannot make it to the hospital because he needs only about 4 to 5 minutes for his brain to shut down. So the guy had
Completely.
a brain damage, and the next thing that ensues is that he dies. A lot of us will not come online to come to start explaining these things to people, and it's easy for people to start, trying to grab at straws. But what happened was the fact that Mobad was mismanaged. There was a poor health-seeking behavior, and there was a medical negligence, and there was a huge act of quackery that was involved. And at the end of the day, you buried him immediately. When you bury him, the body, once someone dies, there are several
Someone
reactions that
buys.
happens in the body, and the body starts liquefying. So when it liquefies, one of the contents that liquefies is the stomach contents. And then you exhume the person after 48 hours. You're unable to get these things the way they are. So you cannot provide a good sample for morbid analysis or histopathological analysis. But at least they were able to get these medications in the system, which showed that he did have something. But you cannot assess the mark cells because you cannot take the samples anymore to go and check to see if he had any major release of histamines and whatever may have happened. What was it that what would have been that undergone the correct postmortem analysis and was not buried immediately. However, we do have a pointer clinically that from the events that led to his death, the clinical symptoms he had preceding his demise, that this is clearly the case. And let me let you know, a lot of Nigerians die like this, unfortunately. In my practice, I have I've also encountered cases like this, but of course, we do have a box somewhere, and everybody notes the sign when it's happening, and we do know what to give. And let me shock you: if you give the person an epinephrine, that is adrenaline injection, in 9 out of 10 cases, they make a 100% recovery. You see them talking the next minute. It works like magic. That was what Mobad did not have, and that was what was not in that box. And that was because the person that went to treat him was incompetent and was not licensed or trained enough to offer such treatment at home. Now, the case about Mubad and his wife and his father, whatever, I am not interested in any of that. But the medical reasons that led to his death is quite explainable, and I'm sure any clinician like me who knew who followed the case and the events and everything that happened knew what happened. The day Mubad died, I tried to read an extensive report about what happened, and it was clear that he died of anaphylaxis.
Say bye. You can't use the DEI word.
Okay, sorry, and he died, and it was clear that he died. It was anaphylaxis that died him. And I'm sure, I just hope that Nigerians will let the emotions out and also understand that there is a science to this, and it does happen to a lot of people, and we should look out for these things. If you go to the hospital, please be mindful to ask them what medication you're taking. One of my very best friends died like this. To a hospital, they gave him an injection, and that was it. That was in 2023, and he recently got married. A lot of Nigerians has died like this. Oh, he went to the hospital, they gave him medication, suddenly he started jacking, said he couldn't breathe, it's anaphylaxis. So before
And in a
you go
situation
to
like that, what if they don't have can you use something like ephedrine? Can you use
So ephedrine is another resort. You can use ephedrine. Ephedrine is reserved in cases where you've given because they are sympathomimetic agents. That's what we call them. When you give adrenaline in IM injection, it's constituted as 1 in 1,000.
for those listening who don't know what IM is intramuscular. That's the one you get in your bum bum.
Exactly. It's intramuscular. If you give it the first dose, it comes just in a pen, and you could wait for 5 minutes. And if the person has not made any recovery, you can repeat the dose. In a case where this has not worked, then you can give the adrenaline as an infusion, as an IV, but it has to be done by an anesthetist who is specialized to do that. And in a case where this has not worked, of course, you have to be moved to the ICU, and then they can now give you ephedrine, but they may need to take over.
Say na nurse when they move you go ICU inside house.
Exactly, which is the reason why you should have at least an EpiPen. What the EpiPen does is that because if she has at least 2 EpiPen there, you give him the first one, it's not working, you put him in a car, you give him the second one, it buys him some time because it opens up the airway to some extent. He will feel some relief, even though you will realize that he's not yet completely recovered. But that would give him the opportunity to make it to the hospital, and that's the idea about it all. So for people, if you go to the hospital or you go to the
Can you
chemist
get
and you
this in Nigeria? These pens that have these dosages, can you?
Absolutely. I practiced it in Nigeria for at least 4 to 5 years before I left. And while I was working with Nigerian Army, we had it, and these things are available. The thing is that, like I said, if you make me the Minister of Health in Nigeria, the first thing I'm going to do is to close up all the private hospitals in Nigeria.
Wow,
Everyone would
why?
have to come, and every hospital, because the highest delivery of quackery in Nigeria is from our health institutions. Unfortunately,
Oh,
everyone
wow.
would have to come on. Everyone would have to come on to
Wow.
have a particular retraining, not just on the management of a common emergency, but identifying these emergencies, having the basic equipment and the kits available to manage them, and also training on the non-technical skills such as communication, because communication alone would have saved him. If only those questions were asked, you would have known what he's had in the past, what he cannot have.
Wow.
So to everyone, this is the question: any medication anyone gives you, what is this medication? If they're not telling you the medication, please, you have the absolute right to reject it. A doctor, a nurse should be able to tell you what medication they're giving you. And you should know if you've had this medication at any point in your life. If you had any form of reaction whatsoever, do not keep it to yourself. Let them know. And in any case where they insist on giving you the medication, ask them if they have the emergency kit. Should you have any form of allergic reaction? If they are not happy to do that, please, if you have the strength, walk away and go to another place. They should have it. If you don't have it, you have no business running an emergency service.
Guys, are you listening? Are you listening, guys?
So, I do hope with these few points that some of these things could be led to
few
rest.
points.
Whatever it
You
is,
have
is
lectured us
fighting.
on everything.
Whatever it is fighting with the family. That is secondary, and that is immaterial. On the primary reasons for his mind, that has been established.
Someone said, I'm a registered nurse in the US. Let's go back home and build our country. That's not what we're talking about right now.
And then another thing is this. I need to make this point clear. I understand that the distrust in our system. I understand we do not trust our government, and I understand that we do not trust our politicians. But I want to give us a little bit of lecture on who provides histopathological diagnosis. It's a doctor who has gone through medical school, graduated, did his housemanship, served, wrote primaries, what we call primary examination, to train as a morbid anatomist and histopathologist. Goes on to undertake postgraduate residency training for at least 6 years. Did exams before he was certified to become a morbid anatomist and histopathologist. He's a consultant, and he teaches other medical school students. He trains us because one of the courses that we offer the medical school in our third MBBS is pathology. And the pathology is divided into 4 parts. The morbid anatomy and histopathology, it's taught by a consultant morbid anatomist. These guys are well trained. They are well trained. His reports are not solid. It does not have any need for whatever you guys are going to give him. He's self-made. Trust me, he is. He provides an independent report. It is left for you to make out of the report what you think it is. Now, the report might have been read by the police, might have been read by a legal person, but that report was provided after in-depth analysis. It takes time to prepare the slide, into frozen slides, run the slides. This slide goes through several checks. He's not the only histopathologist that might have gone through this check. They will have a meeting, a multidisciplinary team meeting, where they look at the slides before they make a decision on the final diagnosis. And with the final diagnosis, a report is made. So it's not just your average Nigerian who can easily be solid. And it's not just one person, it's a group of persons.
Wow. Now, do you think there could be any foul play in this Mobad's situation as a medical practitioner?
Yes.
What role do you think the wife played? What role do you think social media played in the demise of Mobad?
Okay. I'm going to speak from a medical perspective. The reason is that if there was any role anyone played, it is something that would have led to the death, something that he would have eaten, something that would have been given to him in any form, something he would have inhaled. If there was something that was inhaled, when you inhale something, it does result into what we call as a pathophysiology. Pathophysiology is the processes that a disease takes place before it produces an effect. And it means that you're going to see this effect in his special organs and the tissues. And to do a post-mortem analysis, it's not just you actually go through every of the specialized organs and tissue. You check the lungs, you check the stomach, you check the kidneys, you check the liver, you check the heart, and you check the brain, and you check the intestines. If you find any substance which shouldn't be there, it's sent out to another specialized lab where it is analyzed to know what the substance is. When this substance is isolated, the substance is studied based on its properties and what is already documented, evidence-based documentation about that substance and what it can cause. In this case, it will be established that this is the substance that might have led to the death because this is what it does to the body. There is nothing like that that was isolated. There's been nothing like that. No comment has been made as regards his major organs. So I do not think that it is for any other thing that anybody must have given him to eat, injected, or anything he may have inhaled.
Now, what do you think about auxiliary nurses? I'm sure since you said you worked in Nigeria before, you might have had your experience with auxiliary nurses. What do you think?
With all due respect to anyone who is an auxiliary nurse here, I do not mean to denigrate you. I do not mean to insult your professionalism, but I do not think they receive the requisite training necessary to practice. Now, an auxiliary nurse is not meant to work as a leading nurse who cares for the patient. An auxiliary nurse, what it simply means is a supportive care. An auxiliary nurse is equivalent of what we have as the healthcare assistants here in the UK. So the role of an auxiliary nurse should be to provide support to a registered nurse. An auxiliary nurse is not a registered nurse. How do they undertake their training? You have facilities like the private hospitals who want to cut costs. They set up something that is less than a school and employ someone to teach you about the act of administering medications, checking the vital signs, things they shouldn't have any business doing in the first place. Now, when these people have undertaken their training after a considerable period of time, they attack the auxiliary nurse. You cannot find the auxiliary nurse system in most first world countries. Even if you were to find it, they would undergo requisite training and their rules will be clearly established. But go to some of our private hospitals because they cannot afford to pay. If they can't afford to pay a registered nurse at least 150k, they employ the auxiliary nurses, and having the experience to work with them, they pay them things in the tune of 15, as of when I was in Nigeria, 15, 20 to 25,000 naira, because they are cheaper labor for these doctors that runs the private hospitals. And of course, you can understand what I meant by saying that the first thing I'm going to do is to close lots of them down. The highest level of quackery does not happen in the street. The highest level of quackery happens in Nigerian hospitals, I'm afraid, but I have to state it the way it is. And I'm also, unfortunately, being a doctor, I've been someone who lost my mom to the system, lost my younger sister to the system, and lost my dad to the same system. So
how did you lose so many people to the system? What happened?
My mom had a fibroid, and there was bleeding, and she wanted to have a hysterectomy. I was a house officer then. I was
How old was she? Why would she opt for a hysterectomy? Why didn't she just have the fibroid removed?
No, that is the patient, because that was what led me towards becoming a gynecologist. And then the funny thing is that this is a procedure I do via, hysteroscopy, a camera looking and then get it out, and in 10 minutes I'm done.
So that means you'd use keyhole technology to get it done?
Yes, most of our operations here are keyhole.
Oh, wow.
Now in Nigeria, of course, there was not that
keyhole. They will cut you from top to bottom like this. Like, say they want roast meat. Hey, we've lost doctor. Hey, make I see name so I go if you bring them back. Doctor. Network. Oh. Doctor, please come back. He's still hanging. Hello.
Daddy Freeze. How you doing?
Are you a doctor as well?
Yeah, Dr. Obi. I'm joining from Maryland, USA.
Medical doctor, MD?
DMP.
Please. American system is different from our own. Which one is DMP? Please explain, sir.
So, DMP is we come through the nursing route.
Oh, okay. So you have like a doctorate in nursing.
In nursing, yeah.
Oh, awesome. Your contribution is.
I like what the physician was saying.
He's a brilliant physician, as in.
But where I wanted to come in is what he's talking about auxiliary nursing. This is actually some of the things that concern me that I have not had the time to start talking about it, because what Nigeria is doing is very bad. They are not paying registered nurses, and because of that, they are using these auxiliary nurses. These auxiliary nurses are supposed to clean patients, give them bath, feed them where they cannot feed themselves, and just support them. But in Nigeria, you see them giving injections, and you see them doing suturing. Like,
no way.
I'm telling you, that's a relative of mine that had a deep cut, and they went to the hospital. I was talking to them on the phone, and they said the doctor was not around, that it was a nurse. There was a nurse that sutured him. When I asked the nurse, it was an auxiliary nurse that sutured somebody. Just imagine, like here, even a primary care doctor cannot suture somebody. That's a surgeon. That's what a surgeon would do. Now, I have some relatives in nursing school that I'm sponsoring in nursing school, right? So look at it, Daddy Freeze. Like some people I gave scholarship. I spent about let me say 800,000 naira a year per session for their tuition. By the time you calculate, their feeding, accommodation and stuff like that, you're probably going to be looking at the whole thing, maybe like 1.5 million a year, right? So if they do that for 4 years, I think it's 5 years because they got to do all the clinical experience. If they do that for 4 years, that's 6 million. For 5 years, that's 7.5 million, right? And these people will graduate, and the first job offer they get is 70,000 naira. That's a registered nurse will come out with a 70,000 naira. And we wonder why everybody is leaving Nigeria. Wonder why everybody is leaving Nigeria. So these nurses, every one of them, I have over like 120 something nurses who are like, who are trying to see how can you help me to migrate and stuff like that. So Nigerian government need to do something about paying our nurses well. I think a registered nurse in Nigeria is not supposed to earn anything less than 500,000 a month. Anything less than 500,000 a month is an abuse, And they make them work long hours. They make them work these long hours with this so much number of patients, and a whole lot is happening in our hospitals, So if the government to the health department, to the Ministry of Health, can tell these doctors you cannot use auxiliary nurse beyond their scope of practice. If you do that, you are going to be sanctioned, right? If the Ministry of Health does that, then the doctors will going to start looking for registered nurses, and then they will pay them well. But it looks like the Ministry of Health look the other way, while these doctors pay registered nurses poorly, and on top of that, use these auxiliary nurses. So it's something that we need to do something about.
Thank you. I want to see if I could bring the doctor back so we can have this conversation more robustly.
Yeah, somebody say 500K for Nigeria economy. I'm telling you, they deserve more than that. They deserve more than that. It's not about Nigeria. We're talking about health here. You know, I mean, we're talking about healthcare here. It's a matter of life and death. You know, do you know how many people have died in Nigeria?
Have Kpai, please. Let's keep it Kpai.
Sorry. You know how many people,
Pop my money gun, guys, if you're enjoying the conversation.
Yeah. So how many people we don't buy because of they gave them the wrong injection? You know, they gave somebody a short-acting insulin instead of giving them long-acting. You know, these things happen. Like my own mom passed Bongoli. My own mom passed because of hypoglycemia. She had a low blood sugar, and they were administering, they were withholding food and anything from her because she had the symptoms, and they thought her blood sugar, because what they know is that she's diabetic, which when she does like this, it means her sugar is high. So instead of giving her something to eat, even a bottle of Coke or whatever.
Yes. Because they monitor blood sugar. Sometimes when you notice that your blood sugar is, you are going to hypoglycemia, quickly drink some sugar to balance it out.
Yeah, but they were withholding this thing from her, and she was like that for almost 24 hours. By the time she went to the hospital, her blood sugar level was 38, and she went into a diabetic coma, and she never came back from it. That's how she passed. She was in diabetic coma for 4 days, and she eventually passed. You know, so
wow.
And it was a quote unquote nurse who was sent to come and be visiting her, but it was not a registered nurse. It was not somebody who went to school and was taught, you know, healthcare. So we need to, and the ones we have, they are all leaving. Like everybody's leaving, and you're not going to blame them. If somebody will graduate from school and they get a job of 70,000 or 100,000, but that's what people make here in an hour, you know. So if they have opportunity, they are going to leave. We wonder, like, I run a staffing agency. I've been running a staffing agency since 2000. Nurses from Nigeria. I never advertised Nigerian nurses come, because then it was easy. During COVID, it was easy to bring nurses from anywhere. But I never did that because I looked at it that, you know, Nigerians need these professionals. And, you know, I might as well hire people who are here already. Why should I go to Nigeria and start bringing people, right? So I never campaigned to move Nigerian nurses and doctors out of Nigeria so that they will get paid better, you know. But now that it's happening to me, based on I have my own wards who I'm sponsoring in school, and they are going to come up and they are going to be making something that is going to take maybe 30 years for them to make back what I spent to train them in school. So I might begin to have a second thought. Maybe I might look at, you know, trying to help them to migrate. You know? So that's it.
Bongoli. Ayodeji Bakari.
Yes, sir.
How are you doing?
Good evening, everyone. I'm doing very well. Thank you. Good evening, Doc. And to the other doctor that was speaking, thank you all for all that you guys are doing, saving lives. I know it is not easy, the kind of job that you guys do. You guys are always on call, 24/7. So thank you very much. And to my sister, saying hello to you also. So,
Hi.
I have, this has been bothering me for years now. And the more I get information about it, the more my eyes open up to where we are as a nation. In Nigeria today, we have less than 50,000 doctors. And 50,000 doctors catering to about 230 million people. I know for a fact we have a deficit of about 300,000 doctors. We have a deficit already of about 300,000 doctors. Now, when I hear us talk about, oh, doctors need to be paid more and all of that, I get taken aback a little bit, because we need to understand the kind of economy that we are in Nigeria. So now, there is healthcare, and then there is the business of healthcare. I am not a doctor. I don't have any background in medicine. But I know that there's what is called access, quality, and cost. And for this conversation today, I want to talk about cost, because I know healthcare is on that tripod: access, quality, and cost. We know that healthcare is heavily subsidized in Nigeria. So if healthcare is heavily subsidized in Nigeria, what do we expect? If we say yes, doctors should not even be paid 500,000 naira. I think doctors are paid, I think for starting, they get a decent amount in the context of Nigeria. But it's far, far, far from the remunerations that they get in the Western world. Now, the question is, and the challenge here is, if we want our doctor to earn 2 million, 3 million naira per month, which they deserve, and even more, and also our nurses earning maybe somewhat that amount also, which they deserve, and even more, shouldn't we be collecting more money from Nigerians for healthcare services? Because healthcare in Nigeria is heavily subsidized. That means the government is paying for a lot of things. We are getting aids and everything, and even the healthcare, the medical education or healthcare education is heavily subsidized. So how are they going to get paid more money? So I want to hear your thoughts as a medical doctor.
Let me answer you, Bongoli. So, in most part of the world, right? Some countries use like health insurance system.
Oh yeah, come, I'm ready.
Even in Nigeria, there are some states that are good, because I've been studying. There are some states that are good. They have like their own state health insurance system, whereby if you are from that state, you join, you pay a certain amount of money, and if you are sick, you go to the hospital, you pay, they pay you 10%, and the other one will be covered, right? But at the end of the day, right, whether we want to do a free healthcare or we want to have Nigerians pay the full price, the important thing is that your healthcare workers and professionals, they need living wage. A nurse who went to school for 5 years, I'm not even talking about doctors, a nurse who went to school for 5 years and get a bachelor's degree, nursing is one of the most difficult jobs, right? Very psychologically. So a nurse who went to school for 5 years and get a bachelor's degree and work for 2 years, do they not deserve to own a car and live in a flat? If they deserve to drive a car and live in a flat, okay, what is the living wage that can get them there? Or are you saying that somebody like that, somebody like that who's a professional, does not deserve to live just a decent life? Because if you have a car and you are living, let's say in Lagos, for instance, right? Let's say you are a nurse and you live in Surulere. I'm saying where I know you live in Surulere, for instance, and you are working in VI, right? If you fuel your car full tank the way it is now, probably between 50 to 75,000, and it's going to last you a week. I come to Nigeria all the time, so I know it's going to last you a week, right? So if you take the low end, which is 50K, that means the fuel to drive to work is going to cost you 200K a month. You can do the calculation. If they're going to enter bus or whatever, it's still going to be more than 100K. Okay. Now you talk about feeding, we talk about rent, we talk about everything there. So however you want to look at it, you can have your healthcare workers or any worker for that matter, but we're talking healthcare now, not being able to just live it. I'm not even talking luxury life. I'm talking decent life that will give them the comfort to be able to save lives of if what they do. And if you calculate the cost of living today, you know that even 500K is management. So I don't know where the money will come from, but we need to figure it out.
Okay, so now with that being said, I understand what you're saying, but let's talk real reality here. The budget of the Federal Republic of Nigeria today is not up to the budget of 15 mega hospitals in America. In America, for example, the mega hospitals, they budget a minimum of about $2.5 billion annually, and or even more. And then when you multiply that by 15, That is
John
already
J.
our budget in Nigeria already, which is total $36 billion. And now we have the public healthcare, and then we have
Okay,
the
what's
private
his name?
healthcare. So now we begin to confuse
All right, send to me, please.
ideology here, like economic ideology here. So is it that we want a welfarist society in Nigeria? Do we want a socialist society in Nigeria? Or do we want a capitalist society in Nigeria? Because with these kind of ideologies and thought processes, we can now see where will the funding come from. Because if we look at everything for the most part, we have free healthcare in Nigeria to some certain extent. If we look at the primary healthcare, the secondary healthcare, and the tertiary healthcare, when we look at the primary healthcare for the most part, it is almost free. You talked about insurance, for example. We have healthcare insurance in Nigeria. Now, it's been riddled with corruption. Like people, like Lagos State, for example, has somewhat of a robust insurance and healthcare insurance in Lagos State. I know they have that for a fact, and they go out to a lot of people in the informal economy for that. So when we gather this pool of money, and remember, like I said, we already, which you know, you are aware of this, we have a deficit of over 300,000 doctors, meaning that the doctors that are less than 50,000 in the whole of Nigeria are working like jackals. And I respect them and I give kudos to them. So now, public and private, because people say our government should pay the doctors more. I agree.
Yeah, you can do it on post.
Doctors should earn maybe 3 million, 4 million, 5 million naira per month. Easy. But the question, where will the money come from? Like you said, I don't know where the money will come from.
Yeah, okay.
When you put in the math,
From the point of view of a healthcare professional, I'm not a politician. I'm not talking on from the point of view of politicians. They are the ones who decide to run for office and solve the national problem. They got to figure it out. But I'm saying that if you want a doctor to provide healthcare and do their job, if I tell you what is happening in some of our hospitals, some of these doctors are doing to make ends meet. If I tell you that a lot of people who go through some certain surgery in Nigeria actually does not need those surgeries. Some surgeries are ordered for people so that they can get money from them, so that the hospital will keep getting by. If I tell you that I have had somebody come here from Nigeria and a woman, and we were doing some certain things, and they found out that this woman had one kidney, right? You know, we found out that this woman had one kidney, and when it was investigated more, we found out that this woman's kidney was removed surgically, and she didn't know. She had a CS operation to have a baby, and that's the only abdominal surgery she ever had. But one of her kidney was missing. This is a current case that, you know, they are trying to figure out what happened. So if you don't pay it in this way, you pay it in the other way. If you go to our general hospitals, all the doctors there, they have their private mushroom hospitals where they have some patients who come there and they will divert them. You know, so they work as government staff, and when they come to see some patients, they will divert them to come to their clinic. They will even divert some supplies and some materials to their private clinic, where they will go and charge people so that they can be able to eat. Because at the end of the day, however we want to do it, if you don't pay it in this way, you pay it in that way. Somebody who went to school somebody who went to school, and our lives depend on them, you got to give them. And I'm not even comparing with the US. I'm talking about a living wage, whereby you sit down and say, okay, how much would this person need to be able to live a decent life? Now, remember, they pay for this school even though it's subsidized. Like my relatives I'm talking about that is going to nursing school, it's a private university, right? So it's not subsidized. They are paying full because the government schools are not.
Doctor, I've sent you a request. Doctor, please accept. I've sent you a request.
Okay. So at the end of the day, however the politicians want to figure it out.
Yeah, should I wait for the doctor to come in?
Who is that?
if we want to have,
Yeah, who is that?
have to pay.
I can't see the other doctor.
Is who?
The other doctor. I can only see that the freeze and the lady here.
Ofure, my darling, please, I don't know. Please press X. I can't even see you. Please press X.
Okay.
God bless you, Ofure. I'm so sorry. I didn't know Ofure was there.
Doctor, I completely understand what you are saying here. And I think
politicians need to figure it out. You politicians need to figure it out. You see the way we are building houses for judges in Abuja, right? Doctors need houses before judges. It's the doctors.
I agree. Doctors and teachers, they need to be treated much better. We need to have better remunerations for them. But my fear, my concern here is when we say this, do we look at the other side? Do we look at the true reality of our country? Like I think it was you or the other doctor that said it. That talked about how private companies exploit. Now, I'm not taking sides or picking sides with private hospitals. Far from it. But you said they use auxiliary nurses. Maybe it's you or the other doctor. I stand to be corrected. They use auxiliary nurses. They pay them 50, 60, 70,000 naira. You're about to say one share. They will go and share and become auxiliary nurses. While the nurses, the registered nurses that went to school for 4 years, 5 years, 6 years, did residency, all that stuff, they're supposed to be paid maybe 150 to 200,000. I think that's even low. They should be paid like 500,000. Now the question is, if they charge them this amount, that means what we are paying for in private hospitals, for example, which is 20 million naira, could be 50 or 60 million naira. Now, I could say I came from a place of a little bit of privilege because growing up as a child, I was privileged by my parents. Thanks to them.
Dr. John J., you were opportuned.
I had free healthcare from 0 to 26 years. I didn't even get to 26 years before I left Nigeria. But I've always had free healthcare and all my family. So you could say, okay, maybe Bongoli is speaking from a place of privilege. Like that's my own experience. But then when we look at the whole society as a whole, my own ideology is we need to break even for us to even have quality health because access, quality, and cost. Because if you have good cost, access and quality will come. So in my own ideology, I'm thinking it must break even. From a public standpoint, a public sector standpoint, whatever people are paying into our hospitals. Now, I'm not talking about corruption here, because corruption is the big mammoth here. Whatever we are paying in should be able to sustain that institution.
Bongoli, I have a question to ask you because you've been talking and I've been listening. You live in America, right?
Yes, and Nigeria too.
When you're sick or unwell, who do you go to?
If I'm sick or unwell, I go to the hospital. I see a medical doctor, a clinic. It depends. Okay. Urgent care, whatever care.
I mean,
clinic, hospital,
no, I don't mean emergency care. When you're having headaches and you have like blocked nose, you have flu-like symptoms, who is the first person you go to?
Well, honestly speaking, I've not been in that situation before.
Okay. So, in medicine, courses are actually broken down into primordial, primary, secondary, and tertiary. And when you want to talk about the delays in accessing healthcare for any reasons, it's also broken down into primordial, primary, secondary, and tertiary. When you're sick, the first person that you go to is the primary health physician. Now, the primary health physicians are family doctors, and the primary health physicians work in a clinic setting, sometimes outside a hospital setting. In the UK here, we have what we call the GP surgeries, and we have the NHS hospitals. When you are sick, the first place you're meant to go to is your primary health care person. And then when you see them, and they can assess you and offer you, treatment. If they think that whatever is the reason that you came to the hospital, it's something that will need a specialist input, of course, they will arrange or make a referral, advise a referral depending on jurisdiction.
Yes, true. Yes, yes. I have a family doctor. Yes, yes, you're right.
In this case, in Nigeria, two wrongs cannot make a right. I totally agree with you that health is expensive, it's costly, and there is no two ways about it. Now, how do we get it right? If you don't work on your primary health care centers, if you don't have a viable primary health care, then you would quackery will always proliferate, because when people are sick, they do not have a primary health care center to attend, and because they don't have a primary health care center to attend, the first place they go to is the private hospital, because there's a lot of bottlenecks going to a general hospital or even the tertiary institutions like the teaching hospitals because of of those delays. So it still goes back to the government, because the first thing you have to do, if you set up your primary healthcare facilities to work effectively, you've solved 50% of the healthcare problems in Nigeria. I'm going to give you an example. It's good you noted that you're not a doctor. I am a doctor, and of course, I'm also interested in the managerial aspect of healthcare. When I was serving, the first place I was posted to was Ekiti State, and it was in Ekiti General Hospital. And this night, I was in this hospital. It was one of the most horrible nights of my life, and I was managing all the hospital and the departments. I had a core member who was 26 weeks pregnant, and then she was having a preterm labor. And I had a woman, a primate. It was her first pregnancy. Her baby is breech, which means the
leg was coming forward.
First. Yes, the bomb was coming first. And as I was dealing with this thing, I also, that night, I had a child who was vomiting and having diarrhea, and the nurses could not put in an IV access, that is a cannula, to give the child fluid. And I had another patient that was brought in that had stroke, and I had to manage all this myself alone. In the midst of this, the light went off in the hospital, and then they had to run the generator. I managed to deliver the lady, the core member, who was 26 weeks pregnant. The baby, unfortunately, didn't make it 26 weeks because it's Nigeria, of course. There's nothing, and it was in the it was in the rural setting. Thankfully, she wasn't bleeding, so that was sorted. I had this other lady who was progressing. She was 8 centimeters, 9 centimeters, and there was a midwife who was looking after the woman, and I had to go in to use a torchlight, shave the child's head, because that was the only place. The child was so dehydrated that there was no vein I could see. I had to shave the scalp, and then managed to get in the cannula in, and then started rehydrating the child. And of course, I had to go and assess the child that came in and had stroke. Started on the primary regimen, the best I could. As I was doing this, I had to go back to deliver the lady. Eventually, she had the baby through the pump, but she had a nasty tear, and I used my phone torchlight. My battery got exhausted. Yeah, it got exhausted. My camera got exhausted. I had to get from another person's phone. I was describing going to pharmacy to beg them to give me cardboard sutures to be able to repair, because the man doesn't have any money anymore.
So for tears like that, you use catgut, not silk.
That was no. You don't use silk. You don't use silk at all. Silk is
You have to remove. Catgut absorbs.
Yeah. So catgut absorbs. That is what is used in Nigeria. We don't use that here.
I know, because when I'm hearing catgut, I'm like, where are we?
So at the end of the day, I managed to be able to fix this woman with a torchlight, with a camera light, about the third phone that was dead. Now, I thought I had handled my night, and I thought I had already had a successful night, and it was 5 a.m. and this all started about 6 p.m. and I was alone. And lo and behold, a lady was brought in from a health center. She was white, stone cold dead. What happened? She had a baby, and she was bleeding, and they couldn't control the bleeding, and they put her in a car. By the time they brought her, they just laid her on the corridor, and she was dead. And
she don't cry.
I felt so bad, but I had to be professional as much as I could. But I looked at her and I checked her. I knew she was dead already. I told them that she was dead.
Tell her, say, don't buy. Instagram will give us problem.
Bye.
Doctor, I'm waiting patiently. I'm listening to you very well.
What was I trying to...
Sorry, we're rounding off in 5 minutes exactly.
Okay,
I've got to go.
Just a minute. What I was trying to arrive at is that this is the problems I faced, and it was a result of a primordial factor that was not fixed. The general hospital is a secondary center. A lot of the problems I dealt with, like the woman that went to the health center, if she had a well-equipped health center, she would have been alive to today. She would not have any reason to come into this thing. Most of the primary care centers in Nigeria are dead. And I'm telling you this thing as a doctor who had the luxury of working in the most deprived places. I worked in Zaria, I worked in Damaturu, I worked in Jakusku, Yobe State, I worked in Boronu, I worked in Dapchi, I worked in Azadambua, I worked for MSF and UNICEF. And I can tell you clearly. Yes, I worked when Boko Haram was hitting Nigeria. I was chased by Boko Haram. I was shot at by Boko Haram. So I had all these experiences. The problem we have in Nigeria is our primary health care centers are moribund. Fix them.
We have 4 more minutes, Bongoli.
Okay, let me say in a minute. Bongoli will say funding, right? But most of this primary care funding, the budgets are there, but it disappears. You know, if you check, because we don't audit these things, right? If we follow the money, you know, check the healthcare budget for 2024, right? If you do a forensic audit, you will see the percentage of it that just disappears. So I know that the funding is a problem, but with the little we have, because how you know this, right? Go to poorer countries, go to Benin Republic, you know, go to Togo, go to poorer countries that have small budget. I know they have small population, but they also have way small budget. Some of our state governments have more budget than some of these countries. But go to these countries and assess their healthcare, check their budget, see how much they are using to achieve better results. So it's not just about we don't have money. It's about the judicious use of what we have.
Doctor, my doctors, I agree with all that you are saying. To the first doctor that spoke before you, my other doctor, I am of the opinion that we need to focus on preventive and preventative healthcare. If you look at our budget, for example, only 10% goes to preventive and preventative healthcare. And I believe that, because looking at the stats, I know I'm a stats guy, I believe that about 90% of our problems will be solved if we focus more on preventive and preventative healthcare. And
how many of the people in your country are well educated enough?
Yeah, that's what I'm now I'm going to link it up to the primary healthcare, and that is where the primary healthcare for the most part comes into play. However, in Nigeria today, primary healthcare is under the local government, not under the state government. And averagely in Nigeria, every local government averagely in Nigeria gets only about 200 to 250. I said averagely, only 200 to 250 million naira per month, and they have to take care of the whole local government. That is build roads, and 1 kilometer of road in Nigeria today is going for about 1 billion naira. But you want them to fix road. I'm not giving excuses for them, far from it. But I'm just letting us know that there is serious strain on the system. And secondly, I don't always want to talk about this, the corruption in primary healthcare centers, the corruption in secondary, the corruption in tertiary, in specialist centers, you know, and federal medical centers also, where we see what people like us are doing. When the government budget and buys syringes, buy medicine, buy equipment. In Delta State, there was an equipment, 200 million naira, in one of their general hospitals, is missing today. Nobody knows.
I totally agree.
It happened in
Just to correct an impression, someone said that some of this, all the doctors there have Jabad. The reason I Jabad, I'm going to make it clear. I wanted to get the best training, and I do come to Nigeria at least twice every year. I love that country very much, and I'm still going to come. I'm going to practice in Nigeria, and I'm going to enjoy my practice in Nigeria.
Thank you very much. Thank you very much, sir.
I just want to get. I just want to get the best skills. Then I can help.
Me, to get my own self clear, I was never a doctor in Nigeria. I was never in healthcare.
Thank you.
I jacked back in the US and I decided to go to school here and get into healthcare. So I was not educated in Nigeria, but at the end of the day, we are all going back home if the system will allow us.
Yes. We are all going back home. Bongoli is also going back home.
Whether it allows me or not, I love that country. I'm alive when I'm in Nigeria, I'm sorry.
See, my doctor, when you are in Nigeria, that the freeze, and by God's grace, we are going to bring you to Amuwo.
I just came back from Nigeria.
Yes, I just came back from Nigeria also too. But we are going to bring you to Amuwo Odofin. We are going to bring you to Riade LCDA. We are coming. We are having our local government elections tomorrow, and Boda Roscoe is going to win. Ebon Roscoe is going to win. And I'm going to speak to you via the freeze, and you are going to come. And I will not digress a little bit. Yes, local governments are in charge of 67% of the roads in Nigeria. Again, Mr. Igwe Ike and my brother, local governments are in charge of 67% of the roads. So my doctors, finally, I know that it is not your field, because my other doctor cleared the air that me, I'm just in the business of giving care. Now I'm going to ask you, I know you talked about insurance and all.
2 minutes more.
From your own perspective,
Bongoli.
Yes, 2 minutes. From your own perspective, to both doctors, what can we do to better fund our healthcare system? Now,
the first thing to do to fund the healthcare system is, first of all, you talked about the preventive, the preventative approach, and it's multifaceted. The government have to play their role, especially the local government. Their autonomy is very important, and then they have to play their role. One, and secondly, I'm going to say this: a lot of people are not going to like it. We should be able to make a distinction, regulate the religious practices in Nigeria, because it does play a huge role with how people assess health and then what happens to them. It is very important. And then after that, of course, the corruption and then setting up a medical legal framework. Someone has got to do it. It's important that it gets done. Otherwise, people are not going to take their job seriously.
Do we need people to pay more for services? My doctor also.
Trust me, if you put things in place, set up primary health care that people have access to health, people are going to pay. You know why? How I know. When the economy got back, when the naira was floated, you would think that Nigerians will not survive, but they are. They are surviving. If it's working, trust me, people would be more willing to pay because they know they are going to get something out of it.
Okay, thank you.
Let me chip in. I tried to do a clinic in my hometown. I was setting things up. I already had a building and everything, but when I did the business plan, I found out that it can only run as a charity. I cannot depend on what they will pay me and be profitable, except I want to cut corners and do mago, right? That's why I have not started, right? Because I looked at how much it's going to cost me to run that clinic, run generator, pay staff, do all the things I need to do. And I asked how much, because I was going to have a maternity and an outpatient and a mini clinic, right? I said, how much do women pay when they give normal delivery? They said 25,000 naira. And I said, how many delivery are we going to do in this place before we can be able to pay one nurse? You understand? So I found out that for that place to run, I have to be putting money on it. So I'm not ready for that yet. That's why I'm not. So eventually people will have to pay more, right? People have to pay more. Then some health insurance, like there is one that Soludo.
It's not just about people paying. Non-technical skills. We must learn how to communicate with people. It is very important.
Yeah. So
someone should come to the hospital, know the reason they came to the hospital, be able to tell you what is wrong with them without fear of being judged, should be able to get clarity on the reason that they are having what they are having. They should be satisfied at the end of the day. They should be able to give you feedback for improvement. We must institute that. It's important. If I have a facility, everyone must be trained on non-technical skill, and those skills would have to be trained every single year. It has to be renewed, and you have to be assessed based on that. It is very important. It's not enough just providing clinical care to patients. The non-technical aspect of the of working as a clinician is important, because at the end of the day, people are not able to go to the hospital. They don't like the hospital because the way you talk to them. They don't like the hospital because the way they are treated. They don't like the hospital because they don't even know what is wrong with them by the time they're coming out of the hospital. These things have to be sorted. It's important.
Thank you very much, my doctor. You know, I'm telling you thank you because I'm learning a lot from you and ensuring that in my community where I'm from, these are part of my proposals that I'll be proposing to Bodaro School, because I know he's the one in charge of primary health care, our primary health care center that's in Supply Town. I know that one for a fact.
Let me give you this information, in case if you are there.
Let me
give you this information. Nigeria has a whole lot of population of young people who don't have what to do, right?
All right, guys. I'm sorry. I have to go.
I also have to go, guys. Thank you so much for your time. Thank you, Bongoli. Thank you so much, and God bless you.
We can produce like nurses and doctors. The government should invest and produce more professionals so that those who will japa will japa.